Do your gums bleed while brushing or flossing? It is not normal. Actually, it means your gums are in danger and are screaming for help. By the end of this video, you will understand why you should not ignore gum disease, and ignoring gum disease will actually lead to tooth loss. Also, you will understand how to treat early form of gum disease at home and what your dentist will do in the later stages of gum disease. When gum disease starts, it is known as gingivitis. Gingiva means gums and itis means inflammation. Gingivitis, aka gum inflammation, happens because of the collection of plaque on the surface of the teeth near the margin of the gum. Plaque is a soft, sticky, colorless coating made up of bacteria, food particles and saliva. It irritates the tissues of the gum, which react in the form of bleeding, swelling, soreness, redness and bad breath. Gingivitis is totally curable if the right treatment is given at the right time. You can treat gingivitis at home by strictly following oral hygiene practices. Regularly brush your teeth twice daily with a soft bristled toothbrush. Floss every day, preferably before brushing. Avoid sugary and processed food and snacking between meals. Use warm saltwater rinses between meals. Use interdental brushes to clean between your teeth. Consume lot of fruits, vegetables and water. In addition to oral hygiene practices, you can meet your dentist who will scrape away unremoved plaque that has hardened into tartar. Bleeding gums can also occur in other conditions like hormonal imbalance, which occurs in pregnancy, menopause and menstruation. It can also occur when you have viral infections like HSV and HIV. Nutritional deficiencies, especially vitamin deficiencies, can also cause your gums to bleed. Gum disease progresses into periodontitis when gingivitis is untreated. Not all forms of gingivitis develop into periodontitis. It depends and varies from person to person, and there is no particular time within which gingivitis converts to periodontitis. So periodontitis happens when soft sticky plaque hardens into tartar and accumulates below the gum level. It leads to damage of the soft tissue which connects the gum to the surface of the teeth and root. This leads to the gum becoming loose and forms deep pockets. This pocket is a reservoir for bacteria, plaque and food particles. The deeper the pockets, the more the plaque, the tartar and bacteria. Further damage happens wherein the soft tissue is totally lost and bone is also getting destroyed. At this stage, your gums pull back and fall away from the tooth surface, exposing the roots. Now your teeth is very painful to hot and cold food and drinks. Even chewing and biting is very painful because your teeth start shaking as the bone supporting it is getting destroyed. Periodontitis is not reversible. It should be treated only by a dentist. Periodontitis is triggered in people who are diabetic, who smoke and use tobacco regularly, and who have a genetic uh, reason to develop the disease. So your dentist will perform deep cleaning procedures where the roots of your teeth and the pockets are cleaned to remove any tartar, plaque and eliminate bacteria. Sometimes the diseased gum tissue is cut off and it might have to be reflected to clearly visualize the root surface to clean it properly. When bone is destroyed in the progressive and later stages, it is replaced by using a bone graft, which may be artificial or natural. The root surface of the teeth is also covered with tissue grafts. Periodontitis requires continuous and constant maintenance procedures where you will have to meet your dentist regularly. Your dentist will carefully assess and monitor how your teeth and gums are responding to the treatment and will often clean your teeth, which will happen every 3 to 6 months. You will also be prescribed antiseptic and antibacterial mouthwashes along with strict adherence to oral hygiene practices. Periodontitis is not reversible. Your dentist will only manage the disease and not completely cure it. It is very important, and I cannot stress the importance of treating gum disease in the gingivitis stage itself, so that you can be saved a lot of time, teeth, bone, tissue and money.